Well, hello, it's Bruce Williams again, and today I want to present Gross Path Challenge number 71. Big day for me. I get to go do some physical therapy. I'm going to head for the JPC for a couple hours this afternoon, so I'm looking forward to getting out of this apartment for just a little bit. Before I do, I want to make sure that we had time to spend together to do some gross pathology. So slide number one is tissue from a young piglet. Can you give me a morphologic diagnosis and a cause? Okay, time's up. Remember Williams' rule of red guts, number one in production animals. It's probably going to be due to Clostridium perfringens. Sure, this could conceivably be a torsion. We don't see that in very young animals very much, but a condition that we do see in piglets less than a week of age, often less than 4 days of age, is Clostridium perfringens type C. You can also see this in sheep, you can see it in calves, you could conceivably see it in foals. And the thing about Clostridium perfringens type C is it really is a disease of the very young because the beta toxin, which causes this lesion, the lesion is not just hemorrhage, but it's necrosis. It's a severe, often transmural necrosis. It's a very characteristic look, but you've got to identify not only the agent, but the toxin to come up with a definitive diagnosis of this condition in this particular animal. The morphologic diagnosis is going to be diffuse segmental necrohemorrhagic enteritis, and the cause Clostridium perfringens type C. Remember, it's that beta toxin. The key to it being in young animals is the beta toxin is trypsin label. So that's why we don't see it in older animals who are secreting trypsin, because they digest it, they break it down, and it's not effective in causing damage. But young animals don't have trypsin because their body is geared for the first couple of days of life to absorb colostral antibodies. And if you had trypsin, you break down those colostral antibodies. So this is a disease of the very young. Slide number two is tissue from a cat. Can you give me a morphologic diagnosis and a cause? Okay, time's up. A couple of days ago, I showed you a really beautiful case of oligodendroglioma in a dog. You know, it's the exact same place arising in the white matter of the cerebrum. And I said that it's going to be well demarcated and it's going to be very gooey because these cells produce myelin. And if you said that this was an oligodendroglioma, I'm afraid you're incorrect on this. It certainly looks like one, but there are multiple sites. Here's one right here. Here is another one right here. It does have that ooey gooey look to it, but in cats, this is what cryptococcosis in the brain looks like. Remember, cryptococcosis has a dimorphic yeast. We see the yeast in the brain, we see the mycelia out in nature. It produces a mucopolysaccharide capsule. Okay, so this helps it keep from being phagocytized. Macrophages simply can't get around some of these. The capsule deficient ones tend to be not very pathogenic because the macrophages can gobble them up. When they produce this extensive mucinous capsule, which you can stain with a particular stain called mucicarmine, then it keeps them from being phagocytized. Something else that it will do when it's growing in the brain is to produce certain peptides which resemble melanin. Remember that a lot of the stuff in the brain comes from the neural tube, and melanin is very characteristic of cells that are derived from the neural tube. So the normal defenses in the brain say, there's some melanin-like substance here. So probably this is normal. So that also helps it gain a good foothold in the brain. You don't see a lot of cerebral cryptococcosis except in two species, cats and horses. Horses are another one where you can see this, and you can also see it in immunosuppressed individuals, AIDS patients, in which it is known as a cryptococcoma. If you've ever seen the movie Philadelphia with Tom Hanks, just an amazing and heart-wrenching movie about the AIDS epidemic back in the mid-90s. It was his cause of death. He had a cryptococcoma as well. Just a little bit of trivia that you might not know. It is very likely this cat also had a respiratory infection. It is one of the rule-outs for inflammation around the nose. And so this animal may have sniffed it up, got it in up near the cribriform plate, and then it invaded the telencephalon, or the olfactory lobes of the brain, and made its way deeper into the cerebrum here. So cryptococcosis in a cat. Remember that there are multiple forms now. It used to be Cryptococcus neoforme, then it became neoforme variants, Grubii and Gattii. Most of the time, this is seen in your typical neoformans. Neoformans or neoformans grubii are seen in immunocompromised animals. But Gattii is one that goes after immunocompetent animals. So you don't have to have concurrent fetal or FIV or other diseases to get this problem. Slide number 3 is tissue from a wild rabbit. Can you name this condition and give me a cause? Okay, time's up. We're looking at a hard tumor on the skin of this animal. Might have had a couple of them. So you can see when you cut it, it's not very gooey. It is very hard. This is known as Shope's fibroma. Dr. Shope was a virologist that worked at NIH. He was a Navy man many years ago, and he got a number of things named after him. And so it is caused by a lepropox. And a couple lectures ago, we looked at a squirrel that was covered with pox lesions. And it's the exact same virus. Lepre, meaning rabbit, can cause two completely different diseases in rabbits, not to mention causing disease in squirrel. This is the localized version, and it is a proliferation of atypical fibroblasts. Okay, the other disease that's caused by lepropox virus is known as myxomatosis. It's a high morbidity, high mortality disease that causes tremendous edema. It causes immunosuppression in affected rabbits, usually very high mortality. It gets into an area, sort of kills all susceptible animals, selects for a non-susceptible strain, and then you're okay for 15 or 20 years when it comes back and immunity is waned, and you see it again. Shope fibromas don't kill any rabbits, and they have been used in emergencies. You grind them up. They've been used as a vaccine because it is the same virus to vaccinate against myxomatosis, but nowadays we've gone much farther than that. So Shope fibroma, lepropox virus, and just this hard mass on the skin of a wild bunny rabbit. Slide number 4 is tissue from a horse. Can you give me a morphologic diagnosis? Okay, time's up. I could have asked a whole lot of questions, but I didn't want to give it away. This is sort of a busy slide, and it shows how you have to look at the entire slide to get to it. Most of the lesions that we shoot are usually in the center of the slide, but this one's not. Everything looks pretty good. The cerebellum looks good. I don't see any hemorrhages in the brainstem. There's some hemorrhage up here, but sometimes you have to, you're cutting these things open, so you get a little bit of extra hemorrhage. And then as we go down, then you always want to check for in a horse, especially older horse between the ages of 12 and upwards, is for a mass in the pituitary. They are fairly common, even more common in ponies. And I personally own a horse that has one of these. Much easier to treat nowadays. They get a drug called Pergolide, which extends their lifespan. And this particular neoplasm not only has a lot of blood in it, these can be very vascular with large vascular dilated vessels I don't think that that's hemorrhage. It's just so much vascularity. Well, also, what I want you to see is that I want you to see that it is pushing upwards on the hypothalamus. And this goes to two totally different diseases. We used to lump them all together and say that these affected animals had PUPD, and they sweat all the time, and they have long hair which they don't shed out, and that they have increased levels of cortisol, and there was the hypercortisolism in horses, along with a number of other hormones like beta endorphin, which makes them a little sleepy. Well, we've realized now that there are two actually different diseases here. There is the endocrine secretion, where you get hypercortisolemia and high levels of endorphin. But the other condition is now known as pars or pituitary pars intermedia syndrome or disease, PPID, pituitary pars intermedia disease. And this is caused simply by the growth of this mass and the pressure upwards on the hypothalamus. And the hypothalamus is the area of the brain that regulates a lot of these cyclic conditions, such as shedding of hair, such as eating and drinking and thirst. So the animals become polyphagic. They get fat. They drink a lot. They also urinate a lot because of that. So they have PUPD. It controls shedding and sweating. So you can have an animal with a pituitary tumor that is simply secreting the hormones and giving you those particular list of diseases like hyperglycemia, hypoaldosteronism, things like that. Or you can have an animal that has the PPID as well. Now, a lot of these animals, especially ponies, also have a third condition, which is unrelated to this, which is metabolic syndrome, which results in insulin resistance. It's a very complex thing in some of these older animals, but there's a great paper. If you want to know more about diseases of older horses, especially pituitary adenoma, I would strongly recommend a paper published by Peg Miller 2 years ago, which details all the findings in a selection of 125 older animals, and I think 24 out of 125 had pars intermedia adenomas, and maybe 4 or 5 of them had the concurrent PPID. Great review paper on old horses. Slide number 5 is tissue from a calf. Can you give me a morphologic diagnosis? Okay, this is an interesting, it's another cross section, and we are looking at a tumor at the point of the mandible. And this is one that's very tough to get to a distinctive and definitive diagnosis simply based on this, because there are a number of conditions that you can see right here in the mandible of the calf. It is associated with teeth. Remember, they don't have any on the upper side. So all these are at the bottom. And I will give credit for a number of tumors. First one that I would probably give credit for would be a ameloblastoma or fibroameloblastoma. This is something I didn't learn as a resident, and I've learned over the last couple of years that it is a tumor of calves, generally affecting, and often affects the mandibular incisors. This particular neoplasm has a lot of things going on, a lot of this whitish hard material, which might represent large islands of ameloblasts. So I'm gonna put that at the top of my list. Okay, another possibility, because we have all of this white material, would be that this would represent an odontoma. An odontoma would be an odontogenic tumor that has multiple components, sometimes very well formed, almost teeth, but that would be a very nice interpretation for something like this. The last one I'm not as crazy about, but I've seen it a number of times in younger animals at the point of the mandible where there be an ossifying fibroma. And I think those are good. So I really like if you go with the mieloblastoma because it is probably the most common tooth tumor or tumor of the jaws in cattle. They don't get a lot of them. And odontoma, certainly I'm giving full credit for. And ossifying fibroma, going to give you half credit for that. But that's a goodie too. So sometimes you can't always get to a diagnosis grossly, and that's why the goddess above made microscopes, so we can figure it out. And a couple good sections, you'll have this one figured out in no time. Oh, tissue from a piglet. Can you give me a morphologic diagnosis, a cause, and name the condition? Okay, time's up. I said it's a piglet. We tend to think of so many diseases we read about in books in swine as diseases that affect a wide range of ages, or they affect adult diseases, and there aren't that many. If you're an adult pig, you probably don't get sick all that time. But if you're in that, weanling, growing, finishing phase, you get mixed with a lot of pigs, you often will get a number of diseases. So most of the diseases in pigs affect younger animals. It's important sort of to understand what a grower and a finisher and a weaner is when it comes to pigs. So what we're looking at is we are looking at a lot of hemorrhage on the epicardium of this heart. And this is a condition that goes by the name mulberry heart disease. I don't think I would know what a mulberry is if one fell out of a tree and hit me in the head. As far as I know, they could grow on bushes. But it's always been called mulberry heart disease. And in my early days, I thought, well, there's a lot of hemorrhage and necrosis here, and it's just a disease of the myocardium. And it's really not. Mulberry heart disease is a disease of the vessels. Okay, there is severe vasculitis, which is especially profound in and around the heart, but you can see in other parts of the body as well. The disease is the result of an imbalance of vitamin E, selenium. Notice how I said that, an imbalance, because if you go back to the literature, you'll see a lot of places say, this is vitamin E. And then another part of the world will say, this is selenium. Another part will say, well, all of our vitamin E and selenium are both good, blah, blah, blah. So no one has ever agreed it's a deficiency of vitamin E, it's a deficiency of selenium. They both are very prominent antioxidants in the body, and an imbalance of those will cause vascular lesions. It's extremely well known. You can see vitamin E, selenium causing hemorrhage and necrosis in the cerebellum of turkeys. You can see it also in pigs or chickens, causing a disease known as exudative diathesis, which is another vascular disease, this one causing tremendous edema. But in the heart, it causes vascular necrosis or fibrinoid necrosis of the vessels. And by that mechanism, it causes the myocardial necrosis that so many people associate with the disease. My morphology with this would be multifocal coalescing myocardial vascular necrosis and myonecrosis. So mulberry heart disease, vitamin E, selenium imbalance. Remember, there's a number of diseases that you can get in pigs of different age groups with vitamin E, selenium imbalance. You can get hepatosis dietetica. We've mentioned exudative diathesis, but hepatosis dietetica is another one where you get a panlobular or massive necrosis of the liver. So mulberry heart disease, it's a great picture. It's a fantastic lesion of young pigs. Tissue from a horse. Can you give me a morphologic diagnosis and 3 possible causes? Okay, time's up. Well, this is a bad looking leg. I'm gonna bet you this horse is from somewhere sort of south of the country, in sort of swampy areas, maybe Louisiana or Florida or something like that. And his leg is all swollen up because he has a condition that is caused by one of 3 agents, and most commonly it's caused by Pythium insidiosus. This is pitheosis. The morphologic diagnosis for this one is fairly interesting. This is a fungal disease, but what it does over time, this is, and I don't use this term very often, but this is a chronic active lesion. And I believe that for a couple of diseases, and pitheosis certainly is a good one, because you get these focal areas of very active inflammation. Um, and interestingly, pythium causes an eosinophilic response. Now, you don't stain pythium very well on H&E, but what you see in these large masses of fibrous connective tissue, which is the chronic part, are these active areas of eosinophilic inflammation. And if you look really close to those, eosinophils are sort of crammed back together. They are degranulating. They sort of form a reddish field. If you look really closely, you're going to see the negative outlines of those fungi. Now, they'll jump out at you if you put a silver stain on it, but it's sort of fun to look and see if you can pick them out. And they're sort of slender. So my morphologic diagnosis of this one is going to be a chronic active and eosinophilic cellulitis. This is a deep infection. You can say dermatitis, paniculitis, and cellulitis, or cellular, however you want to go after it. But I want to see chronic active, and I want to see eosinophilic in your morph because very characteristic. Now, I asked you for 3 morphologic diagnoses. So one I've given you is pythium, and I have learned the hard way on this, that when you see those fungi in tissue and you get a great silver stain, zygomyces, and another one called laginidium, which I don't know if has been identified in horses yet, certainly has been identified in dogs and then also in cats. They look identical. And I probably got burned, and years ago I thought I could tell the difference, and I probably misdiagnosed. Nowadays, you got to go get the PCR. You can culture these. It takes a long time, but just writing down pitheosis or whatever, it's not going to make a difference to the animal. It's going to be a tough one to treat, but you're probably going to be wrong as often as you're right. Remember that if you dig out these areas of active inflammation, you get sort of these granular, desiccated, odd-looking spiculated tissue, which are called leeches or conquers. And this condition also can affect the GI tract as well. But most of them, these are mesomycetes. Well, at least pythium is a mesomycetozoan, which lives in swampy area in plant detritus. So this animal's gotten in some water, probably had an open wound here. They don't pass through an intact epidermal barrier very well. But open wounds, they can colonize and get in there and cause a real problem. Pythium insidiosum. Okay, slide number 7 is tissue from a ferret. Can you name the disease? We'll keep it simple. Okay, time's up. For most of you, this is not going to be simple, because this is one that we see not that uncommon. Is the disease of male ferrets, and you got to really look at the anatomy, and this is a tough one. So if you didn't get this one, don't feel bad. Ignore this piece of wood. Okay, there's not a wooden foreign body. What we're looking at is the urinary bladder here. Can everybody see the urinary bladder? It's been incised. Here are the ureters here. Kidneys will probably be up here and here, and they're dumping into the trigone. Then we have the penis, and like other mastelids, you have the os penis, or the bone of the penis. So there's the penis here. Then we have this area between the bladder and the penis, which is essentially should be prostatic urethra. And there are multiple huge cysts here. Here's one here that hasn't been opened. Here's a gigantic one. Maybe some other cysts in the wall. Okay, this was a condition we identified back in the 90s at the AFIP, yay AFIP, when I was doing a lot of ferrets. And it is associated, so only seen in male ferrets. And before we identified this condition, we didn't even know, people didn't even know that ferrets had prostates. There was a paper in a pretty prominent anatomic journal back in the late 60s. It said ferrets don't have prostates. Ferrets don't have prostates. When we first started seeing adrenal-associated endocrinopathy in ferrets, we realized that ferrets have prostates. And what happens is these animals with adrenal-associated endocrinopathy will secrete high levels of variable amounts of testosterone, estrogen, and progesterone. Well, estrogen, as we have seen before in other species, causes a squamous metaplasia of glandular epithelium. And what's happening is the prostatic glands become keratinized, and the body hates keratin. And so it goes after it with a very profound suppurative response, and these keratinized prostatic glands essentially become huge sacs of pus. And they become very big, they become cystic. The animals cannot urinate through this. You can squeeze their bladder and they'll urinate pretty readily. They cannot initiate voiding on their own. These have to be drained, and then you give the animal some, believe it or not, some minoxidil or Rogaine, which is not only good for growing hair, or maybe it's not good for growing hair, but it also will shrink the prostate if you get it early enough. 48 hours with this condition, total urinary blockage, is going to be really tough to come back from. So this went by a bunch of names. Used to be called the triple bladder syndrome. That made no sense. Really, it is cystic prostatic disease in male ferrets who have concurrent adrenal-associated endocrinopathy and high levels of estrogen. Oh, we're getting close. We only have a couple more. Hey, they're both from cattle. This one's a little reddish, but I like the lesion. So can you give me two morphologic diagnoses? Okay, time's up. What's red really should be orange. This is like bright orange. This is like neon orange. If you ever walk down Tokyo at night, this kind of colors that you see. Absolutely love it there. So this should be orange, and this is hepatic lipidosis. And the reason it's hepatic lipidosis is because the other lesion shows up so nicely. This is a lesion that you might miss in a normal colored liver. So everybody's pictures have hepatic lipidosis as a background. Why is this cow hepatic lipidosis? I don't know. I got no idea. But the lesion here are these areas of hepatocellular loss in cats and cattle. It's called telangiectasis. Nobody really knows why. You just see these large areas of hepatocellular loss. Some people say, well, it's due to pre-existent bacterial infection, bacterial shower of the liver, but no one's ever been able to prove that. But it's just loss, and then you get hemorrhage or at least pooling of blood in these areas where the hepatocytes have decided to just up and disappear. In rats and people, it's called pileosis hepatis. It's the same lesion, but because so much of the early rodent pathology was done by humans who've been calling it pileosis hepatis since the mid-1800s, it got that name and it's sort of stuck. Same thing, just large areas of hepatocellular loss and hemorrhage. Some people say it's congestion, but it's part of it. It is a pathologic process. We just don't know much about it, and it's so common. People say it's an incidental finding. Some people call it sawdust liver when they see it. Sorry about the color on this one, but it's a great lesion. The last one, actually, I'm going to show you two pictures on this. This is tissue from an ox. Here's picture one. Not the greatest picture because it's fixed. Picture two is not fixed, and it's a close-up. Picture one. Picture two. Can you name the condition? Okay, I know a lot of you out there are scratching your heads on this one. Well, this one is, some people say it's incidental because it's fairly common, but I think it's part of a pathologic process. It certainly indicates a pathologic process. And we'll look at this one. Okay, what we're looking at is the placenta, and we are looking at a cotyledon here. And this is normal. And, the ruminant placenta is studded with cotyledons, and all of the blood exchange between maternal and fetus occurs here at the caruncles of the mother, the cotyledons of the fetus. Oh, this is probably just a caruncle because the placenta has been removed. So this is a caruncle. But all of the, and here you see them down here as well. But what happens is in animals that do not have enough, okay, so the body senses that you don't have enough of these caruncle cotyledon interfaces to exchange all the blood, to exchange the waste, provide oxygen to the fetus. The body is going to respond by putting down additional caruncular material to try and take up some of the load. Okay, it's inefficient, but it's an indicator that there is placental insufficiency in this animal. And so you get to remind me like unpopped popcorn or something like that. They don't look like the caruncle here, but it's the body's trying to get additional surface area for blood gas exchange in the placenta. The condition is known as adventitial placentation. It's primarily seen in cattle. And other things that you might see are some diseases that are associated with deficient placentation. So that might be hydrops or hydrops allantois or hydrops amnion in these animals because they cannot have a normal fluid exchange. So it's a great lesion. Some people say it's not a lesion, it's a body's repair process trying to right a wrong, but it's called adventitial placentation. It's in Jubb and Kennedy's Pathology of Domestic Animals. So I'm going to call it pathology because they do, and they're a lot smarter than I am. So there's our 11 slides today. Hey, I hope you enjoyed this one. This one was fun for me. So let's see. Tomorrow is Friday, and we have a great lecture by Dr. Paolo Parato starting at noontime Eastern Daylight Time, which is my time here in Washington. I hope a lot of you have signed up for that. If not, you can still sign up. There's still seats available. We're going to try and break Zoom tomorrow. We have over 800 people signed up for that. But that's okay because we have 1,000 seats now available on our Zoom account. So hopefully you'll make plans to join us tomorrow. She has agreed to leave her presentation on freshwater fish pathology up for an additional 2 weeks on our YouTube channel. So come back. I'll see you there tomorrow. And then this weekend, maybe some more growth path challenges. Hey, y'all have a fantastic day.